good. Feeling pretty good. Better than the 4 hours I got the other day. But yeah, feeling good on episode 266 of the In the Tank podcast. We're going to be talking about COVID lockdowns and, some healthcare stuff. As always, I'm your host, Donald Kendal, joined by a number of folks here. We got Justin Haskins, editorial director at the Heartland Institute. How are you, good sir?
I'm doing well. I'm excited for the debate tonight.
What's the significance of your hat?
What's the significance of my hat?
Yeah, what is that? Some type of constellation?
No, it is not. Actually, you know what? I'm not going to tell you.
Jim Lakely, VP of the Heartland Institute. How are you, good sir?
I'm doing great. Actually, before we started, you were talking about stuff that you've been watching, Donnie. I was watching by recommendation of Chris Talgo, editor here at Heartland, who works with Justin as executive editor. He recommended The Vow, a 9 or 10-part documentary series on that Nexium sex cult in New York. Good. It is the cult. It is pretty good. I mean, 3 episodes in. It's pretty bizarre, though. It takes a while to get rolling, but man, it's actually pretty. It's actually an example of how Trump infects everything. These people kind of went a little bit nuts, and they went even over the edge because of that damn Trump. It just made them all crazier. It was kind of funny to see that.
Jim bringing up weird sex stuff 2 episodes in a row. Also joining us, we got Charlie Katebi, who is a health policy analyst at Americans for Prosperity. Charlie, what's going on, sir?
I'm doing good. Just enjoying another beautiful autumn day in our nation's capital.
So you have been on the podcast before, have you not?
I am a returning champion, one could say. Yes.
Back in the day, you came on a couple of times, I think. I'm pretty sure.
It wasn't back in the day. Yes, I was a former employee of the Heartland Institute, one could say. And made many appearances with you and our good friend John. Talking healthcare policy.
Wait,
we don't talk about John anymore. Yeah, we only refer to him as the Windex salesman. So please do not bring him up again as a sore subject.
Well, Windex. Clean supplies are very important these days. So.
Well, that is true. And yeah, before all of you people leave comments, yes, Charlie is replacing Isaac Orr.
Thank goodness.
I watched something pretty decent on Netflix. It was a movie directed by Angelina Jolie, and it is titled "First They Killed My Father," and it is about the communist takeover of Cambodia. It's pretty decent. I will say the first half was really good. The second half kind of dragged a little bit. But it was very anti-communist, surprisingly, from Angelina Jolie and Netflix. So if you're interested in that, it's pretty crazy stuff.
So it's a film that her father John Voight would endorse.
They
don't get along very well. They don't probably see eye to eye on a lot.
Yeah, maybe she would. Although,
hold on, wait a second. I think that the listeners have a right to know that Donnie and I had a conversation about this movie just several days ago. And Donnie's very specifically told me not to waste my time watching this movie. So I don't know what kind of sick game he's trying to play on our listeners.
Okay, so I watched it in 2 halves, 2 different nights. The first half was really good, and I recommended it to Justin. The second half was just kind of like a slog. It was just didn't really go anywhere, kind of stuck in the mud as a cinematic movie. And I was afraid that Justin was going to recommend this movie to his wife, and they were going to watch it based on my recommendation, and I didn't want that to happen. So the content of it was really good. I think it would have been better if it was like a 1 hour History Channel documentary type of thing. It didn't really work as a movie, but the content of it was really good, and I think the first hour of it makes up for the second hour.
How can you watch a movie in 2 halves? I mean, it can't be more than 2 hours to watch the movie. Just watch the movie.
You do a lot of weird things when you have a 1-month-old baby. I'll tell you what. So
true indeed.
So yeah, for those people that are listening to this episode on Thursday, you're like, what's going on? Usually the episode's coming on Friday. I was looking forward to hearing what you guys were going to talk about on the debate. But unfortunately, we are recording this on Thursday and releasing it on Thursday. So you're not going to get our coverage of the debate. We could fake it Trump went off the handle. They muted him a bunch of times. The moderator was biased, and Joe Biden, didn't really say too much. Boom. There's our coverage. Anything you want to add to that? Jim, do you think it's going to be anything better than last time around, or what?
I would hope so. And actually, I was the one on the podcast who did not think that the first debate was as big a disaster for Trump as all y'all did. But yeah, I think you're going to get a lot of, obviously, Hunter Biden questions and statements and stuff from Trump. Actually, the idea of the mute button will actually come in. Supposedly they're going to have 2 minutes of uninterrupted time to speak, and then the mute button will come in. So I'm going to have a stopwatch going, man, because I bet you that if he starts bringing up this Hunter Biden stuff, and a lot of stuff broke this morning with a former colleague of his, a business partner, who says that these emails are real. This is not Russian disinformation. It has nothing to do with it. That's all a scam. And that the big guy referenced in those emails who got a cut of the Chinese money that was funneled to Hunter Biden, the big guy was Joe Biden. And in fact, there were some texts or some WhatsApp messages, I think, but some messages between this fella and their handlers in these foreign countries that said, make sure that you don't mention Joe because he wants to make sure that there's separation. And even a warning that this could blow up would that if this gets out, Hunter will be responsible for blowing up Joe's campaign. That came out this morning, and Donald Trump's going to mention all of this, I would think, tonight, and we're going to see if that mute button comes in a little early. I have a feeling it might.
Do you think that Trump is going to refer to Biden as the big guy at any point during the debate?
That would be pretty clever.
It's a really good prop bet. I think there's a chance that will happen.
There is a chance, but I think the only question is how well will Trump be able to cover all of this material and have it come out in a coherent way that makes sense to voters. I know all this stuff because I read about it, right. But can he get that message across in a way that makes sense? That's the real challenge, I think.
No, we can't. That's the answer to your question. And that is the most important question. Absolutely. It is all about making it. You can't just throw out words like Ukraine, emails, Hunter Biden, crime family, and expect for people to piece all this together and realize what you're talking about. And yet that, I believe, is exactly what's going to happen. Donald Trump is not very good at meticulously running through details in a monologue. That is not his strength, to say the least. And so I don't think people are going to understand it as well as they probably need to. If I were advising Donald Trump, and I'm willing to bet that the people advising him now are telling him this exact same thing and he won't listen, I would say memorize 5 sentences about this. Just memorize them and just repeat these 5 sentences. And it would lay out the story very succinctly, very clearly, and it would be incredibly damning if he could actually do this. And it would force Joe Biden to say that it's not true, to address it, publicly. And I think that would be just absolutely disastrous. But I think Trump will just, I don't think it will be clear to people, unfortunately, what's going on. I hope I'm wrong, but I just don't. I don't think people will be any wiser coming out of this than going into it. And unless you watch Fox News, read the New York Post, listen to podcasts like this, etc., you're not going to know the story. You're just not.
Trump actually does a really good job of this during his campaign stops because it's written for him on a teleprompter and he has more than 2 minutes to go through it. So he kind of takes his time and he does a good job. But I think under the pressure of 2 minutes, I think it's going to be more like Justin described than what's useful.
Charlie, are you gonna tune into the debate tonight?
Oh, of course. Yeah, it's gonna be. I mean, it's gonna be a disaster. Biden has proposed a series of terrible proposals, but we're not going to be able to get to that. Because the president, for the most part, is not very good at articulating why these proposals are very
and that's
terrible.
Probably the worst part of it when it comes to and maybe that was the biggest difference between the VP debate and then the first presidential debate is I actually think that there was some substantive policy stuff that was discussed at the VP debate, not so much in the first debate with Trump and Biden. So I don't know. I guess we'll see what happens. Maybe the mute button will help facilitate some actual policy discussion.
No, it won't. It won't. That's the thing. It won't. And that's the problem, though. I mean, there are really important policy issues, and I don't even mean you have to get super wonkish on it either. I mean, there are just some really simple, basic policy issues that need to be addressed. And in the vice presidential debate, there was a lot more of that going on, and it just isn't going to happen in these debates. And people are really getting a disservice from this. There are some incredible things that Joe Biden is proposing. I've talked about this on the podcast several times before. Literally nobody talks about this. Nobody is interested in this in the media for whatever reason. Joe Biden has called for a global trade war to stop climate change. And he said, it's on his website. You can go to his website and read about it. He says that he wants a global trade war to stop to stop other countries from using conventional forms of energy, and that he wants to force everybody, including China. He specifically lists China to use wind and solar, and if they don't, he's gonna craft his trade agreements around this and require them to adopt these things, whether they want to or not, all over the world. And yet nobody's talking about that, even though we had for months listened to people criticizing Donald Trump for his trade policies with China. We haven't heard a word about Joe Biden saying that we should have an even bigger trade war over an issue that the vast majority of people aren't really that concerned about. So why is that? That will never come up. Like, we will never get to that. We will never get to, I hope we at least get to the fracking jobs thing, because that is really important for Pennsylvania. There are tens of thousands of fracking jobs in Pennsylvania, thousands of other jobs that are related to that indirectly. Joe Biden's policy plan is very clear that all of these jobs would eventually be gone because no more CO2 emissions. Are we going to get to that point? Are we actually going to talk about that? Or is it just going to be them shouting at each other and Joe Biden saying that Donald Trump lies about everything, and Donald Trump mumbling things about Hunter Biden, and we never actually... I mean, that's what I'm expecting. Fully and completely.
Well, the Commission on Presidential Debates, which should be disbanded, this should be the last debate we have run by those clowns. They changed the rules at the last minute. This was supposed to be about foreign policy, where fracking comes in a little bit, I guess, with natural gas exports and global energy pricing and all of that. But the fix is in. Everybody knows that, and it would be a great question. Those would be great questions, Justin. Will this moderator ask it? No way. She's not going to ask about that. She's going to ask about COVID. There's about race relations, about American families. This was supposed to be the foreign policy debate, which, frankly, is Donald Trump's surprisingly strongest positions. Although I think he has a lot of strong positions. But on foreign policy, we got peace breaking out all over the place. We have wars that have not been started since he's been president. We have troops coming home from Afghanistan. We have an American embassy in Jerusalem. We have peace deals between Israel and Arab nations, which would have been unthinkable even just a year ago. And none of that's going to be talked about. I guarantee you none of that's going to come up. Again, it'll have to be Trump that brings up these issues, because the moderator is just going to be asking questions that make Joe Biden look good and attack everything that Donald Trump has done in mostly unfair ways.
Hey, has ISIS been brought up one time by anyone? I don't think it has.
Seriously.
It hasn't by a moderator, and I don't think, and it won't be based on the topics. I don't think it's going to be brought up tonight either. And so that was the foreign policy issue of the last presidential election. The issue. It is now no longer an issue. That and the global refugee crisis that was going on at the time, which was related to that. Those were the two things, the two major issues that everyone was talking about. They are solved. That's why no one talks about them, because they're solved. And yet we are literally not going to even hear about it one time from these moderators. It's shocking.
So I want to talk about one other thing before we actually get to the topics that we have planned for this episode, which is an article that Jim, I think you sent this to the group chat. So we've talked numerous times across the last few weeks about Joe Biden's refusal to talk about whether or not he wants to put more Supreme Court justices, expanding it from 9 to 11 or 13 or 15 or however many people he wants to put on the Supreme Court. He refused to talk about his position on that, saying that he'll tell us everything that he has to say about that after he's elected. Right? It's just like the first time in history that that's ever happened. I'm not going to tell you my policy until after I'm elected. But anyways, so he just released something. This is a CNN politics. It says Biden says if elected, he will form bipartisan commission to recommend changes to the Supreme Court. So in this, he says that he wants to put together a panel of academics and Democrats and Republicans, liberals, conservatives, and that they will convene over 180 days and then come to him with a list of recommendations of how that they can alter the Supreme Court to make it more objective and effective as an organization. So thoughts on that? I mean, is that just him trying to split the difference on these policies or these positions of packing the Supreme Court? Oh no, it's not me. It's this objective panel of people that are coming up with this. What do you think? Or no, Justin, go ahead. You're already.
I think it's brilliant. I think it's brilliant politically, because he was in a horrible situation. He had no way of answering that question, and he had dodged it so many times that people were just waiting for him to answer it. So now he finally has his answer. His answer is, I'm not going to make the decision. I'm going to have these other people over here make the decision. And oh, by the way, they're only going to make the decision once I become president. Then they'll make the decision. It was really the only option he had politically that made any sense. I mean, anything else he did would have hurt him. So if he said he's going to pack the court, that would have killed him. If he said he wasn't going to pack the court, then most people would think he's lying anyway, and the left would be super mad that he's not going to pack the court. And so he comes up with this decision to just say, well, I'll create this bipartisan commission. And then what my favorite part, though, about the commission is they come to him. So they get together, they come up with some kind of plan, and then they come to him. And then what? He's just, as a supreme emperor of the United States, just waves his hand and let it be so. All of a sudden, there's 20 judges on the Supreme Court. That's not how it works, Joe.
But Justin, I don't know.
What are you talking about?
I don't know why Biden is so scared of the left to just say, no, that's packing the court is a terrible idea. He defeated the hard left progressives in the primary. He's in the driver's seat, and he said in the past, no, I don't support court packing. I don't know why he doesn't just say that, because frankly, those people don't matter. Those aren't the people in the Midwest and in the swing states that are going to be voting for him. Their vote is already locked up. They're not voting for Trump.
Unfortunately, in Joe Biden's deranged mind, they do matter. And he has made that incredibly clear that he cares about what their opinion is. And he's built these gigantic unity task forces, for example, with Bernie Sanders full of socialists and far left people, Alexandria Ocasio-Cortez, the Sunrise Movement's in there, Stephanie Kelton, who believes in modern monetary theory. These people are all advising Joe Biden. He picked Kamala Harris, who has one of the most liberal voting records in the Senate, who was a co-sponsor of the Green New Deal. I mean, for whatever, I agree with you, Charlie, that logically it makes no sense. The voters that matter are in the Midwest, and the Midwest does not want any of this. All right, I totally agree with that. But that ship sailed a long time ago. I don't know why Joe Biden has decided to go in so deep with the far left. I think it's because he believes, because I think his advisors told him this, that that he was going to win this election. No question about it. Unless he really made the Bernie bros and those kinds of people so angry that they wouldn't come out to vote. That was the way he was going to lose. And so he became so convinced of this that he felt like he had to constantly appease those people. And I think that idea has not left his mind. I think he looks at the polls and he says, I'm up by 10 points in a lot of these polls. Like, I'm going to win. All I have to do is not rock the boat until election day, and I win. And so what he doesn't want to do is do anything to anger really anybody. He just kind of wants to float along. That's why he doesn't do any speeches. That's why he doesn't go anywhere. It's why he doesn't say anything, doesn't take any positions. It's just, I'm going to win by default. That's his view. And that's what he's trying to do. It's a run out the clock situation. That's what it is.
So why doesn't he just do this with all of his policies? He's just like, oh yeah, you know what? I'll tell you about my gun policy after the election. I'm going to put together a panel 180 days later.
He should.
They're going to tell me.
He should, because you know what? Nobody is electing Joe Biden or his stupid policies. They're either voting for Trump or they're voting against Trump, and that's it.
It would be safer than saying I'm going to ban fracking in Pennsylvania.
Yes, it would be. It would be.
Do.
It honestly, it would be so smart if he said, "You know what? I'm going to convene a panel of people, and they're going to get together and decide what to do on fracking." Like that would be smarter than saying, "You know what? I'm not going to ban fracking." Well, what about all the times you said you were going to just get rid of all the fossil fuel? Well, you know, no, I didn't say that. Well, yeah, we got the videotape of you whispering it to this little girl that you look into my eyes. Look into my eyes, little girl. No more fracking. No more fossil fuels. It's gone. That's what he said. And
is that what the video on Hunter Biden's laptop is?
Oh.
But how many promises have you made to children, Justin, and how many of those have you kept?
Yep.
Right.
Good point. Good point. I break all my promises to children as a general rule of thumb.
It's like everybody on TV. Whenever you see a movie, they make a promise to children. That's always the kiss of death. The opposite's going to happen every single time. If you notice that, I notice that all the time.
They usually die.
I know. Yeah, I'm watching something, and then you know, someone is like, they look him in the eyes and they say, "I promise, I'll get you out of here." Like, dead. You're dead.
Yep.
One of you is definitely dying for sure.
Yeah,
every single time.
It's like the Liam Neeson rule.
That's right. But hey, Justin, this is only brilliant if you think the American people are morons. I don't think the American people are morons. I think they can actually understand that a bipartisan commission to explore expanding the Supreme Court means you're going to expand the Supreme Court. If you have the power to do it, you will do it. And that means actually to voters, if they're paying attention, and they should be, and they're not morons, is that there is simply no limiting principle on the Democrat side when it comes to getting as much power as they can. So how many Supreme Court justices do you think they would need? They would say, well, the commission might say, we only need to add 2 more just to make sure the left always has a majority on the Supreme Court. Well, why only 2? What's the limiting principle there? Why not 7? Why not make it so that it's impossible
100
there is nothing. And so this idea that it's brilliant politically that he keeps giving this chicken shit answer that isn't an answer, but actually is an answer. Everybody knows that if the Democrats get total control, Joe Biden is going to pack the Supreme Court. That's why he didn't answer the first time. Oh, well, they should, because that's what's going to happen.
They should, but it's not true, because most people watch ABC News, CBS News. They watch CNN or MSNBC. If you add up all the people, if you add up all of the ratings for all those networks, it is like 10 times Fox News.
I know.
Okay? So that's where most people get their news. So they don't know that Joe Biden is, that there's tons of people on the left that want to pack the Supreme Court. They don't know that. They don't know that Joe Biden actually wants to ban fracking. They don't know these things because they aren't being told. It's not that they're stupid. It's that they don't hear these things from their news sources. That's what it comes down to. If everyone was talking about it, if the mainstream media was talking about it all the time, then they would hear about it and they would see right through it, but they don't even bring it up. And that's why they don't bring it up, because if they did bring it up, then it would cause all sorts of problems for them.
So just a couple of other things before we get to the topic at hand here.
You said that the first time 10 minutes ago, by the way.
20 minutes. Yep. No, I just want to tease next week's podcast because it will be on October 30th, which is just a handful of days before the election. And Jim, for the Heartland office, he put together a how would you describe it? Is it like an election pool? What would you call it?
Yeah, it's an election pool, just like we had our Democratic primary pool, though not quite as fun. Actually, I think it's more fun. But yeah, you have to be able to pick who's going to win the president of the United States. What's the electoral college count is going to be, who wins in Florida, Minnesota, Michigan, Wisconsin, Nevada, and Arizona, who controls each House of Congress, and a couple of and 3 interesting Senate races.
So I think we should either make our picks on that episode or reveal those picks on that episode just prior to the election.
I think that's a good idea. I just want to remind everyone that I won the last pool 4 years ago.
I came in a very close second.
And I finished first in the Game of Thrones pool, which is kind of similar.
It is.
And it is. And so I deserve to be, we need some kind of trophy so that I can have. So
anyways.
Oh, I got one.
The other thing that I wanted to bring up was Amy Coney Barrett. She was just approved by the Senate Committee.
Judiciary Committee.
So it looks like it's going to be going to a flat-out vote, full-on Senate vote on Monday, which just happens to be Hillary Clinton's birthday.
I love it.
Good. Great.
So
I love it.
That'll be perfect. That would be the absolute perfect trolling.
How old is Hillary anyway?
Like a 472, I think. No,
That's
turning
very
473. I think that's what on Monday.
It was very, very thoughtful for Trump to give Hillary that gift on her birthday. I gotta say, right. I wasn't expecting that. That's really, really, really soft-hearted.
All right, let's move on. We got to talk about some. She's turning 73, says our producer.
73. So she's younger than Trump.
Oh wow! Hey. All right, let's talk about some COVID lockdowns. Charlie, you haven't been on the show since the lockdown started. That's for sure.
Yeah.
You are in DC, right? You're living in DC?
Arlington, more or less, DC.
Okay.
Yeah.
So how you been holding up with all these lockdowns? How is DC? Were they pretty strict when it came to that type of stuff?
Oh yeah, DC's been frankly a disaster. They won't allow you to go outside unofficially without a mask.
What?
Restaurants cannot open past 10. Tables cannot seat more than 6. It is so micromanaged and ridiculous. And I'm very thankful that I live in Arlington that have not imposed restrictions
Okay.
that have been that bad. But it's been a very, very hard few months.
Charlie,
you have to wear a mask when you're walking around outside.
Outside, so the mayor ordered people to do this, but lo and behold, it's not an actual law. So there are no criminal or any financial penalties you will face of any kind. But people still wear them because.
Wait, spoiler alert! None of this COVID lockdown stuff is actual law. There hasn't been a single legislature anywhere in the country that has passed a law regarding lockdowns.
Well, Jim,
that's what we're talking about, right?
Well, Jim, you don't need legislatures to pass laws. You can simply just order them and write them down, and then they will, have the force of,
declare an emergency, and you can do whatever you want.
Says a man beaten down by the tyranny of Northern Virginia. Well done.
You're
exactly the kind of citizen I need up there.
Jim, I'm a victim. So what can I say?
Well done, citizen.
I know, Donnie, I can't do it.
Okay.
I can't do it.
All right,
I can't do it. It makes me too angry when Jim goes on his rant about it. I can't do it. Okay. Not today.
Oh, I couldn't trigger you.
Well, there
was still young.
It was a microaggression. That was a big time microaggression, Jim.
There are several lockdown related topics that have been in the news lately. So I thought it would be good to kind of reassess where we are with all of these lockdowns 7 months later. It started in like middle of March, right? Or was it February?
I don't know.
It's been so long, I don't even remember.
I believe in March, mid-March, mid-March. Yeah,
right. So it's been about probably a little bit longer than 7 months. Like this started off as the 2-week thing to make sure that we flatten the curve and not overload our healthcare system.
Hey, is that curve flattened yet?
Any day.
Just wondering. Have we flattened the curve?
Yeah,
just curious.
It's turned into a circle, I think. So anyways, so the Fauci, the grand leader Fauci, do people, does the left hate him now or does the right hate him? I forget, it goes back and forth so often.
I hate him.
Everybody should hate him. Doesn't matter where you are.
Does that count? I actually don't hate him. I don't really care. But
I don't know either. I'm pretty indifferent.
It does seem like a lot of people hate him though on both sides.
Well, it's
pretty
just
interesting.
It seemed like there was like a few weeks right off the bat where like the right hated him, and then it was like he was agreeing with Trump saying stuff, so the left hated him for a while, and I just don't remember where it currently stands. But anyways, he came out recently, and there was an article in The Hill that's titled "COVID-19 outbreaks would have to get, quote, really, really bad before advocating for national lockdown." So in a 60 Minutes interview, I believe, or maybe 60 Minutes just reported on this, Fauci said the outbreaks would have to get really, really bad before he would advocate a national lockdown. Quote, "First of all, the country is fatigued with restrictions. So we want to use public health measures not to get in the way of opening the economy, but to being a safe gateway to opening the economy," Fauci said. So instead of having the opposition open up, open up the economy, get jobs back, or shut down, no, put shut down away and say we're going to use the public health measures to help us safely get to where we want to go. So it seems like Grandmaster Fauci is not necessarily in favor of these hard lockdowns that, like Charlie is describing, are taking place in DC. Now, I guess the caveat could be he said national lockdown and not necessarily these regional ones. So I don't know, Jim, how do you interpret that?
Well, I interpret it as Anthony Fauci double backing on what he said before. He's
triple backing.
Triple backing. I don't know. It's like he's been so inconsistent on everything. The idea that Fauci has all the answers. This is sometimes I think our culture is sick that they crave a strong man to tell us what to do, especially when we're scared. Help us, Dr. Fauci. You're our only hope. First he says that masks, don't bother with masks. Look, it's not going to help you. It doesn't do much because it's true that the virus is so small. These claws that people are wearing over their faces, bandanas, that doesn't do anything for you. It's a psychological exercise in making sure I'm doing all I can to stop the spread. But by and large, it doesn't really do anything for you. So he said, don't bother with it. Then he said, no, everybody needs to wear masks at all times outside, except for when he's at a Nationals, when he throws out the first pitch at a Washington Nationals game, and then he can take it off and whenever he feels like it, around his friends, and laugh and enjoy popcorn or whatever the heck he was eating at that time. And then so he's been inconsistent on all these things all the time. That's actually what Trump points out. It's like in fact, everybody is inconsistent on this. The WHO's that we were told in social media, if you share any information that goes against the World Health Organization, your account's going to be locked down. Well, the World Health Organization, what information and when did they send it? Because they have also been inconsistent, and that should actually be expected. It's called the novel coronavirus for a reason, because we have no experience with it and don't really know how it spreads. We still don't know whether it's through droplets or other ways, or through the air in other ways. We were told in the beginning that you had to wipe everything down. You have all these companies that have spent huge sums of money making sure their entire businesses are wiped down and sanitized. But then later on, it comes out that, surfaces aren't really a very good spreading conduit for coronavirus. So that's, I think, the takeaway here is that it's not to jump on Dr. Anthony Fauci, but there is so much unknown about this that people actually can just, try to go about their lives. We didn't need to lock down the entire nation, as he now is admitting would not be a good idea unless it was a really severe thing. But it was never really that severe. It's always been, and this is the one thing we knew about it from the start, that the coronavirus is most dangerous to the elderly who have several comorbidities that make them vulnerable to this virus, and everybody else has relatively low risk compared to that. Yet we locked down the entire economy all across the world. Millions and millions of people had their lives disrupted. And we have had people that have not gone to the doctor that needed cancer treatments and all of those other sorts of things who have died because they didn't get the treatment they were supposed to get because we're panicked about COVID. So, Dr. Fauci can, go pound sand as far as I'm concerned. I don't think he's as much of an expert as anybody else. And there are experts all across the world trying to figure it out in an honest way, not ways that can completely and continually contradict themselves.
Yeah, and again, there's been a number of articles that have been coming out. So it kind of back up this idea that lockdowns aren't the answer, right? Although seemingly it seems like face masks are the answer. And the only reason that COVID's still spreading around is because there's people that aren't wearing them. Like if you were to just go by social media, that's the narrative. But anyways, lockdowns seemingly aren't the answer. So I've got this article here from FEE, which is the Foundation for Economic Education. It's titled 5 Charts That Show Sweden's Strategy Worked, the Lockdowns Failed. So the first paragraph starts off saying, unlike most other European countries and nations around the world, Sweden declined to initiate a nationwide lockdown or mask mandates, opting instead for a policy that restricted large gatherings and relied on social responsibility to slow transmission of the virus. So early on in all of this, in the news cycle, this kind of elicited really kind of repugnant talking points about Sweden and how they were basically operating under this survival of the fittest approach, and that they were just sacrificing the vulnerable, at the altar of economic growth and all of this crazy stuff. So this does a really good job. This article really does a good job of showing these charts that kind of show that, that wasn't the case. It actually seems like their approach might have been the best. So this first chart, especially if you're watching this on YouTube, you'll be able to see this. If you're listening to the podcast, I'll link all of this in the show notes so you can check it out. So this first chart just shows the daily new deaths in Sweden. Now, this article is a week or so old, or 2 weeks old. So this chart is a couple of weeks old. But I just looked at it today, and the chart actually looks even better than it does on this one. So what you see is a peak of cases in mid-April, and then it just kind of peters out and is basically non-existent by October. Like I said, it's even less so if you move further into October, if you were to see the latest chart.
They're deaths, not cases.
Deaths, yeah, absolutely. Yes. Yeah, daily deaths. So continue to go to the next chart here. So the next chart shows that kind of compares the COVID deaths per million with Spain, France, the UK, and Sweden, and shows that Spain is like, if you scroll, I mean, maybe up a little bit on that, Andy, it's like there are 25 times as many deaths per million, and France 10 times as many deaths per million, the UK 7 times as many deaths per million. So it's like, oh, seems like Sweden's faring pretty well. Let's go down to the next chart. So the next one here says, okay, well, maybe it's just because of how the population is spread out. You can't really compare, countries necessarily apples to apples because some have bigger cities and more urban areas or whatever. So what this did is showed a comparison between some of the major cities in the United States and Stockholm City, and showed that even in those cases, the population density, that Sweden is still doing better when it comes to deaths per million. Go down to the next chart. I'm just going to run through these real quick. So then this one kind of just shows the cases. And this one, the cases, especially if you show the updated version, which I don't have for you, so don't look for it, Andy, is it is actually still trending up in Sweden. But even compared to some of their Nordic countries, Denmark, Finland, and Norway, it's still relatively better in Sweden. And then I think that there's one more chart, or was that number 5? Yeah, and then this one just kind of shows the COVID deaths per million again, but in a different way, and it just kind of talks about the nursing home and circumstances. But anyways, all of these charts put together just kind of shows you that the whole idea that we just need these strict lockdowns as a way to combat this virus was not the case. It seems like Sweden's doing pretty well. Although I could be painting with too broad of a brush here. I don't know. What do you think, Charlie? Let's go with you, Charlie.
I think it sounds like, for the most part, like they made the right decision just to basically say, hey, we don't know what's going to happen because this is a pretty new virus. So they said, we're going to issue these recommendations. We're going to ban large gatherings, but everyone below 50, any gatherings below 50 people, they basically said, go and, do your thing. We recommend you wear a mask. We recommend you socially distance, but we'll leave it up to you. And for the most part, their death count seems to be the same as the United States. And it's hard to say what that means for us, because if we impose a slew of lockdowns, but our death count per million is about 570.
Yeah, but theirs is bottoming out, and ours is still going.
So it's hard.
So I mean, it's like if we're to continue these trends out, it seems like Sweden's going to be doing way better than us when all is said and done.
Yeah, and for the most part, they avoided a lot of the damaging economic restrictions that we imposed as well, where we said, you can't meet with more than 6 people in a restaurant. You have to ban elective procedures in hospitals, which was frankly deadly. And I think that for the most part, they really avoided a lot of that harm that we imposed on ourselves.
Gentlemen, what do you think? Do you think I'm painting with too broad a brush? We comparing apples to oranges, or is Sweden, evidence that we shouldn't have pursued these stringent lockdowns?
Go ahead, Jim.
Well, I want to hear your take on it too, Justin. But I just saw a tweet today that says it links to a story that's written in Swedish that I can't read, but the English setup for it on Twitter says that Sweden removes all restrictions for the elderly. According to Johan Carlson, director of the Public Health Agency of Sweden, the COVID-19 restrictions had a negative impact, and many have lived in isolation and have not seen their relatives face to face for a very long time. And so, the Swedes, although they have taken some measures that have not worked out as well, but it's clear that the lockdowns have had a much much more detrimental impact on the people locked down than the coronavirus itself would. And in fact, Sweden is, I know that the left and the media in this country like to mock the idea of herd immunity as if that's just sentencing people to death. That's kind of what Kamala Harris said in the vice presidential debate. But the fact is, you can't hide from a virus. The virus is going to virus. It's just going to do its thing. And you can't just, lock yourself in your basement until it passes over you like a fog. I've probably said that 10 times on this podcast. Yet our policies in this country act like you can do that. And that if you don't try to do that, you're killing people. That is a child's mentality. And that is not scientific. And Sweden's example is the one that we all should have followed. And oh my God, we all would have been so much better off.
So
a group of scientists did come out with this big declaration that did say, societies and governments should prioritize actually protecting people with comorbidities, protecting people that are the elderly, but self-isolating those people, because those are the people that are the most threatened by the virus. But everyone else should, wear a mask and socially distance, but otherwise go about your life.
Well, So let's go to that, because I was going to bring that up too. That you're talking about the Great Barrington Declaration, which is named after a town in Massachusetts for some reason. But yeah, so like, and I really like this, and maybe I have to read into it more. But seemingly what I've gotten from it, just from what I have taken in about this Great Barrington Declaration, is this idea of like this compromise between not doing anything and restricting everything. It's like there's no mid ground, right? So what this is seemingly suggesting is that there is this mid ground. It says, as infectious disease epidemiologists and public health scientists, we have grave concerns about the damaging physical and mental health impacts of prevailing COVID-19 policies and recommended an approach we call focused protection, the petition says in the opening line. Current lockdown policies are producing devastating effects on short and long-term public health. The petition adds, keeping these measures in place until a vaccine is available will cause irreparable damage, with the underprivileged disproportionately harmed. So it basically says like bars should open, restaurants should open, let's have sporting events again, like everyone can go about your lives. But people that are like most potentially impacted by this, the people that are most at risk, that have those morbidities, should be, take the extra precautions. We should do more as a society to specifically protect those people. And that seems like a pretty common sense, compromise.
And it recognizes that there are real trade-offs to these lockdowns. So if you impose mass lockdowns, it's true, you will reduce the number of people catching COVID and dying from COVID, but you'll also impose a lot of health harms on people. If you prevent people from working and they go unemployed, they're going to have a lot of health issues. We know that suicides skyrocket when there's a rise in the unemployment figure.
Sure.
So like there are real other consequences that public health officials need to take into consideration when they recommend, just completely shutting down the economy, because people need the economy to go about their lives and actually just live a healthy life in general.
But I mean, like, Jim, do you think that like the public at large can get behind this thing that's like I said, it seems to be a common sense compromise between the two extremes? When you have the news media running with it, where I've got this New York Times article where the headline is White House embraces a declaration from scientists that opposes lockdowns and relies on herd immunity.
Right.
And it really just kind of like, if you're just reading the headline, which I think in this day and age, most people just do that. It's just like, oh, he just wants to sacrifice old people in this pursuit of herd immunity. Like, I don't know. It just doesn't. What do you think? Do you think that the people can seriously get behind something like this? Or do you think they're going to be led on a string by fake news media like this?
Well, I don't think Donald Trump's going to be led along a string by the fake news media. But, the New York Times just dismisses out of hand in their lead the idea that herd immunity is going to be the ultimate solution to this virus, as it is for every virus. And so they're just, look, all news coverage is designed to get Donald Trump out of the White House. And they will frankly lie and spin every story to make it seem like Trump is always doing the wrong thing and making the wrong move and killing people and all of that stuff, and never challenge anything. I mean, there are how many people signed the Great Barrington Declaration? Is it up? Is 10,000? Couple tens of thousands?
There's like 60,000, but most of that's general public. When it comes to like the actual experts, I think it was like 5 to 10 or something.
Right. And so, the whole idea of following the science is important. And I think Trump has tried, maybe not successfully, but he has said that, I will. Actually, Mike Pence said this in the vice presidential debate. And I think he said it about both COVID and climate change. It's like, we will follow the science. There's a difference between following the science and following the scientists. Yeah. And usually it's the scientists that are, especially in the COVID case, it's only the scientists who say, lock it all down. Trump is screwing up. We have to, you have to change your entire life. You have to do what we say. And we'll let you know tomorrow if the rules change. It's only those scientists that we're supposed to be following. But the science keeps developing and tells you different things. And thankfully, there are places where, like in Sweden and other places where the science has shown us that a lot of the decisions that much of the Western world have made have been wrong. And in the Daily Beast of all places, which is a pretty hard leftist publication, they have a story that was updated today. It says, Italy did everything right to stop a second wave of the coronavirus. So what went wrong? Italy was once a shining example of how masks and aggressive testing worked to stave off a second wave. Why have things gone terribly wrong? Yes, that's right, because we don't have all the answers. And so the prudent thing to do in this pandemic, as in all pandemics, is protect the vulnerable, quarantine the sick, and let the healthy go about their lives. And instead, we've quarantined the healthy, left the sick, left the vulnerable people more vulnerable, and shut down all of our lives. Right. And this is crazy. It was crazy in March, and it's still crazy now. And I'm still a little amazed that the American people are putting up with it as much as they have.
Yeah, no doubt. The other story that kind of relates to all of this that it got a lot of play, it went somewhat viral, was David Nabarro, who's a special envoy for the World Health Organization, Director General. He came out in an interview and he basically said that, widespread lockdowns aren't the best thing to do in this, to deal with all of this. He said, the only time we believe a lockdown is justified is to buy you time to reorganize, regroup, rebalance your resources, protect your health workers who are exhausted. But by and large, we'd rather not do it. So, I mean, who's even left calling for widespread lockdowns other than the governor of Illinois and local politicians that are looking for specific political advantage?
Well, and that's the point, though, right? I mean, this is the problem with so many issues that we face, not just related to COVID, but with everything. It was so heavily politicized, this whole thing, that it was right from the very start impossible. It was impossible for the right decisions to be made because government does not make decisions outside of their political worldview. It just doesn't happen. Politics infects every decision that they make. And because of that, they were never going to make decisions or do things that was going to benefit the opposite side. That was never going to happen, whether that was liberal governors dealing with their states and whether that would help or hurt Donald Trump, or that's Donald Trump dealing with, the opposite. That's the way that politics works. It's like a zero-sum game in so many of their minds. If something is helping me, I can't allow that to help you too. We can't have actual compromise where we just do what's right for people. It has to be all within this political realm. And I think without question, what this entire experience has shown is that all-encompassing grand national quote-unquote solutions to any kind of problem don't work. That what works in rural Iowa is not going to be the same thing as in New York City. And it was insane. For those of you who've been to upstate New York, you know what I'm talking about. Upstate New York is a different universe than New York City in the New York metropolitan area. Different universe. Everything is totally different. And the idea that you would have a governor creating laws for New York City and for upstate New York is insane. It makes no sense. They literally destroyed millions of people's lives all across the country for no reason. They were shutting down elective surgeries, for example, in parts of the country at the very beginning of the pandemic that had 0 cases in their county, no COVID cases. And they were shutting down surgeries for things like, because we say elective surgeries includes brain tumors, for example. They were shutting those things down in counties with no cases because they were worried about a pandemic that was primarily affecting people in New York City on the other side of the country. It made no sense. And it doesn't make sense to do any kind of policy that way. You should never craft your policies at a national level like that. It doesn't work. With all of that said, I think that there's a huge problem with the way that we've looked at this on both sides of the aisle, the way that we've looked at this pandemic. The solution to the problem was always that they needed widespread rapid testing. That was the answer to the problem right from the very beginning, because right at the beginning, they didn't know exactly how bad the pandemic was going to be. A lot of people were saying 2 million people were going to die from this thing, or at least 1 million. I mean, huge numbers that turned out to be not true. But if we had rapid, widespread testing right from the very beginning, then the people would know if they were sick and then they would stay home. Okay. And that not having those tests, and not just the tests, but the ability to analyze the tests quickly, right away, that was the problem. And that wasn't necessarily something you could blame Donald Trump for. I mean, you can say, hey, you should have had this infrastructure in place. You didn't. But no president had this in place ever in all of American history, because America has never really experienced something like this in modern times. Not since, the 60s or something have we had this kind of a pandemic hit us. But in countries like South Korea, they deal with this all the time, and they were very well prepared. And as soon as they caught wind of this happening, as soon as they had any cases at all, they did widespread testing right away. And that did work. That did slow the virus, because people knew who had the disease, that they were sick, and they stayed home. Yeah. Now, we never did that here. We produced lots of tests. We have lots of tests right now, but you can't analyze them fast enough for people to actually know whether they have the disease. They have to wait 2 weeks after they take the test before they find out whether they've got COVID-19. So that's what we need to prepare for next time, is having that infrastructure in place and being ready to ramp that up at a moment's notice. We didn't have that, and that's the real reason why so much of this went awry. The lockdown thing was it was never going to work. That's the solution.
You bring up the testing, and I know that like early on in this, we were talking about like the FDA and these artificial regulatory roadblocks that were kind of in place that prevented us from being able to get more on top of this. So that kind of brings me to this idea of this little, if there is a tiny little silver lining around all of this COVID stuff, it could be some of these different governments taking down some of these arbitrary rules and regulations around the healthcare industry that could be beneficial. So this is a concept. So some of this is like telemedicine, right? There's expansion of telemedicine. Some of the licensing has been trimmed down, or whatever. But all of this has kind of been grouped together and labeled as Health Care Reimagined, which is a project that our own Charlie Katebi is actually working on. So Charlie, tell us about Health Care Reimagined.
Yeah, love to. Yeah, so at the start of this pandemic, there was this idea of flattening the curve. That was the original reason why we imposed the lockdowns. And that is the one inkling of truth to the whole lockdowns that actually made sense. We don't want to allow the virus to spread and just have a bunch of sick people overload our healthcare system. So what we at Americans for Prosperity said is there are so many barriers to our healthcare system that prevent healthcare providers and healthcare facilities from actually addressing this surge in cases and need. So we sent out a memo to governors across the nation that basically recommended 3 big things. One, they should allow facilities to add beds and services and equipment to deal with COVID without needing to go through a lot of restrictions and approval processes known as certificate of need barrier laws. The second one is saying that healthcare providers like nurse practitioners, physician assistants, and pharmacists actually as well should be able to go to where they're most needed and practice without any sort of restrictions. And this includes allowing pharmacists to test for COVID. And the third one is making sure that all of these providers and all these facilities can remotely treat and consult and triage, if necessary, patients remotely, so that these providers aren't actually the spreaders themselves. So we recommended this, and we've seen a lot of positive outcomes come out of this in terms of reducing the number of COVID deaths in states that have removed these barriers. And as part of Healthcare Reimagined, we want to have the conversation with lawmakers and the public to basically say that if these barriers were so burdensome and so terrible for COVID patients, and we had to remove them, why not just keep them permanently removed altogether? If removing them was so integral to actually defeating the virus, why were they ever in place in the first place? So that's what we want to do. We want to permanently end these barriers once and for all.
So certificate of need laws, these are probably the most like egregious example of just like ridiculous government policy. We used to talk about this topic a lot on the In the Tank podcast in its previous form, back when we had the Windex salesman on here. But yeah, that's basically the idea that like you said, hospitals can't even add a bed in some cases, without getting some type of like approval by some health bureaucracy or something like that. You know, they can't.
20 to 30 states cannot add a single bed unless they go to a government board and basically say that the community actually needs this bed.
Yeah, they have to prove that they need it. Certificate of need, right? And then, like, you know, a bed is the most extreme example, but we're talking like MRI machines or anything like that. Even opening up a new hospital, you have to prove that it is needed in the community. It's a ridiculous thing, and we would always talk about like, what if this was the case with like restaurants? Where like, McDonald's or something would have to prove that the community needs another hamburger shop. And then they have to go in front of a board that's composed of people that work at Burger King and Wendy's, and say like, I need your approval to put a new shop. It's a ridiculous thing. So you were saying that some states are kind of suspending their certificate of need laws to combat COVID?
20 states have temporarily suspended their certificate of need laws to deal with COVID.
So is there any data that kind of shows how those states are faring, that suspended the laws compared to states that didn't?
Yeah, actually, a lot of this stuff is pretty initial because, these changes have just come about in the last several months. But they found that states that suspended these laws and allowed hospitals to add new beds and add new ventilators, they found that these states reduced the number of daily, I think, total COVID deaths by about 100 for every 100,000 residents. So that's a huge fall.
Yeah.
And this owes primarily to the fact that these states just have more capacity to deal with patients when they come in, and they were able to get them the care that they needed in a more timely manner. And that proved really critical for these patients who were older and really had higher comorbidities, and they really needed care very quickly.
So I know it's the goal of Healthcare Reimagined to basically make these changes permanent going forward, right? We don't have to be in the middle of a COVID pandemic for these things to make sense policy-wise. But do you think that it's likely? Do you think that it's likely that states will keep these things suspended indefinitely? Or do you think that, once stuff returns to normal, quote unquote, that they're going to reinstitute all these terrible policies?
So it's already starting to happen. In Kansas, the legislature extended a lot of these reforms. So now nurses and physicians from other states, they can actually go across state lines to Kansas and start practicing without needing a new license. And nurse practitioners and physician assistants, they can practice the full extent of their training and go to the hospitals that actually need them the most without going through a bunch of approval processes with physicians. So this is already starting to happen. And I think lawmakers are starting to get the fact that like these laws don't actually protect patients. Oftentimes they're just there to defend special interests. And right now in the middle of a pandemic, we're starting to realize that, we don't have the luxury of having laws that harm patients to such an extent.
Yeah, no doubt. Gentlemen, any questions for Charlie before we kind of wrap this episode up here?
I do think that it's worth keeping in mind, too, because I don't think that it necessarily, for those people who don't know a whole lot about con laws also apply to nursing homes. And so that's really important, given that many, many people, thousands and thousands of people died in nursing homes as a result of COVID-19. And if those nursing homes had for many years been building up lots and lots of bed capacity and expanding their size and were much bigger facilities, and it was easier to socially distance people in these facilities and quarantine people in these facilities, lives would have been saved. And unfortunately, in order to expand your nursing home, in order to add beds to your nursing home, even if the nursing home is begging for it, they don't necessarily get that. It's up to some con law board to give that to them. And think about how absolutely absurd that is, given the fact that you could have doctors, you could have nurses, you could have people who are in healthcare providers who have been in that industry for 30, 40, 50 years saying we need this. And some board of people who aren't even necessarily experts on this could say, you know what? Nope, you can't have it because we already have enough beds. I mean, that's essentially the system that exists. And it is totally egregious. It is completely outrageous. It's not the sexiest topic, we know, but what COVID revealed was that even these topics that don't get a whole lot of play, they have real impact on people's lives. They actually cost people's lives in this particular situation. And so it is important to stay on top of all of these things, even the things that, again, this is a regulatory change, but it matters. It really does matter. And so the work of Americans for Prosperity and for other groups that are fighting against con laws, this is really important. And we urge everybody who's listening to support these organizations, including the Heartland Institute and AFB, who are fighting for these things, because it does make a difference. You never know when you're going to have a situation like this where you would have wished we had thousands of additional beds and much bigger facilities and many more testing facilities and MRI machines and all sorts of other things. It would have saved lives in this pandemic if we hadn't had con laws. And so hopefully we can convince lawmakers to keep these things off the books going forward.
Jim, I was going to go to you for the last word, but I don't think you can top that. So I think I'm just going to end the episode.
Fine with me.
So thank you all for joining us for this episode of the In the Tank podcast. Join us every Friday for a new episode. If you like our show, please subscribe, write a review for us on iTunes. It'd be greatly appreciated. You can find us on SoundCloud, Stitcher, Google Play, YouTube, pretty much everything nowadays. If you'd like, you can follow us on Socialist Twitter at In the Tank Pod. If you want to send us comments, suggestions, questions to the show, feel free to email us at inthethankpodcast@gmail.com. Justin, where can the fine people find you?
At Justin T. Haskins on Facebook and Socialist Twitter.
Jim Lakely, same question.
At J. Lakely on Twitter, at Heartland Inst for the organization on Twitter, and always visit heartland.org.
Charlie Katebi, where can the fine people find you?
I think it's at Charlie Katebi on Twitter. I have not checked it.
Well, you can also find his work at Americans for Prosperity, too. All right, thank you all for tuning in. We will talk to you next week.